can help to contain the spread of the coronavirus. Wear a mask, wash your hands frequently, physically distance, and download the WEHEALTH Bermuda app today. How does the app work? After a person is tested, if they are positive for the coronavirus and have downloaded the WEHEALTH Bermuda app, they will receive a code from the Ministry of Health. The person will enter that code into the app, and WEHEALTH Bermuda will anonymously notify other WEHEALTH Bermuda app users that an infected person was in close proximity, even if they don't know that person. Because the WEHEALTH Bermuda app does not use or collect personal information or track users' locations, these notifications will be completely anonymous. WEHEALTH Bermuda uses Bluetooth signals to measure how long and how close app users were together. Once you download and install the app on your smartphone, the app will run in the background and alert you to any exposure risks. It uses very little data or battery life and will continue to work if your phone uses Wi-Fi only, as long as Bluetooth is enabled. We are using the power of technology to defeat the coronavirus. Download the WEHEALTH Bermuda app today. This message was brought to you by the Ministry of Health.
Good evening, Bermuda, and a very happy New Year to you all. I hope that whether you had a small gathering in your home, Zoom meetings, WhatsApp or FaceTime calls, or a little bit of all of them, that you and your families had a safe and relaxing holiday season. Our celebrations were different and difficult this year. Not being able to see certain family members, not being able to travel, gather in large groups, and not being able to celebrate as we normally do. Thank you on behalf of your government for your continued sacrifice and the collective effort that we as a country are making to keep each other safe and to beat the coronavirus. One proud Bermudian tradition did go on as the Gombe troops took to the streets. I'd like to thank the Minister of Home Affairs, Deputy Premier Walter Oban, who acted as Premier over the holidays, and the Minister of Youth, Culture and Sport, Minister Ernest Peets, and their respective ministries and all agencies that are involved in ensuring that we can enjoy the Gombe safely on New Year's Day. Thank you to the Gombe troops for their enjoyable and authentically Bermudian performances, which is a unique part of our culture, and also for working with the government to make it all possible and safe for them and for the public. And I want to, of course, say thank you to the public for adhering to the guidelines when watching the Gombes. I saw pictures and videos from areas such as Town Hill and Bailey's Bay of residents enjoying the performances from a safe distance. At today's press conference, I'm joined by the Minister of Health, the Honorable Kim Wilson, and the Minister of National Security, the Honorable Renee Ming, who will each provide updates from their respective ministries. Following that, I'll provide you with an update on the changes that the Cabinet has agreed to the restrictions that are in place and discuss measures that we will take going forward to help us ensure that we secure a safe future and share some reasons for hope. First, we will hear from the Minister of Health. Minister?
Good afternoon. This evening, I am saddened to report that Bermuda has once again experienced another COVID-19 related death. The loss of another life to COVID-19 in the Bermuda community is very upsetting, and I offer sincere condolences and our prayers to the family and loved ones of the deceased. I will now provide today's daily statistics. There were 875 test results received by the Ministry of Health since the last update, and 8 were positive for COVID-19. 4 of the new cases are classified as imported, with the details as follows. 1 resident who arrived on the Delta Flight 617 from New York on the 30th of December 2020 and tested positive on their day 4 test. 1 resident who arrived on Delta 584 from Atlanta on the 3rd of January 2021 and tested positive on their arrival test. 2 residents who arrived on BA's Flight 2233 from London on the 3rd of January 2021 and tested positive on their arrival test. 2 of the new cases are classified as local transmission with known contact, as they are associated with known cases. The additional 2 new cases are classified as under investigation. These cases are among residents with no currently identified links to other known cases or history of travel within the past 14 days. Since the last update, 3 cases have recovered, and as I reported previously, sadly, 1 has deceased. There are currently 99 active COVID-19 cases in Bermuda, of which 94 are under public health monitoring and 5 are hospitalized, none in critical care. Since March of 2020, Bermuda has recorded 632 total confirmed cases of COVID-19. Out of those, 99 are active cases, 522 persons have recovered, and 11 persons have sadly succumbed to COVID-19. The mean age of all confirmed positive cases is 43 years, with the median age being 40, and the age range is less than 1 to greater than 100 years. The mean age of all our currently active cases is 41 years, and the median is 41 years. And the age range is less than 10 years, between greater than 80 years, and those age groups are between 80 and 100. The mean age of all of our currently hospitalized cases is 53, with the median age of 54, and the age range is less than 30 years. Again, the age group is between 20 and 29, to greater than 80, which is age group 80 to 100. The mean age of all our deceased cases is 77, and the median age is 80 years. And the age range is less than 60, age groups 50 to 59 years, to greater than 80, and again, the age group is between 80 and 100 years. The source of all of our cases is as follows. 168 are imported, 384 384, are classified as local transmission, of which 349 are local transmission with a known contact or source, and 35 are local transmission with an unknown contact or source, and 80 are under investigation. As investigations proceed, transmission categories may change. Today's update has 1 case moving from under investigation to local transmission with a known contact or source, and 1 case moving from under investigation to local transmission with an unknown contact or source. The 7-day average of our real-time reproduction number is less than 1, namely 0.62, and Bermuda's current country status remains at clusters of cases. There are a few matters that I'd like to cover with my remarks today. First, the vaccine. I am pleased to confirm that just over 9,000 doses of the Pfizer-BioNTech vaccine are scheduled to arrive in Bermuda on the British Airways flight this Friday, the 8th of January, 2021. Once the vaccines arrive on island, they will be taken immediately to a storage facility. The ministry will begin administering the vaccine doses on Monday, the 11th of January, 2021, to healthcare and essential workers who agreed to take the vaccine. In this context, essential frontline workers are those who provide services which prevent social disruption and allow society to function, and who are also at risk for higher levels of exposure to COVID-19, and this includes firemen, police, corrections officers, and personnel at the ports of entry, as well as teachers. We will also administer the first batch of the vaccine to our most vulnerable, seniors who provide their consent in rest homes and long-term care facilities. There is no cost for the vaccine, and they will be administered at sites arranged by the Department of Health and with primary care physicians who have been approved by the Department of Health. The vaccine will be given in 2 doses. The first dose will be given next week, and for those people, the second dose will be given 3 weeks later. The rollout of the vaccine will proceed along these lines. The first dose, then the second dose administered 3 weeks later. And for the vaccine to be fully effective, 2 doses are required. The vaccine developed by Pfizer-BioNTech has been approved for use in the United Kingdom after meeting strict standards of safety, quality, and effectiveness set out by the Independent Medicines and Healthcare Products Regulatory Agency, which follows international standards of safety. The vaccine has also been approved for use in the United States by the United States Food and Drug Administration. Thousands of people have been given a COVID-19 vaccine so far, and no serious side effects or complications have been reported. Earlier today, the Ministry of Health held a mock vaccination trial exercise at the Hamilton Seventh-day Adventist Church. This was a small exercise designed to provide an opportunity for the Department of Health and relevant partners to assess our ability to document vaccine administration events using the 10 to 8 appointment system and the electronic immunization registry. The drill was limited to the simulated movement of patients through the vaccination process. We will have a post-exercise debriefing tomorrow morning to evaluate the exercise and determine what tweaks and improvements are necessary. Regarding returning residents, the Ministry of Health would like to remind the public that as per the Quarantine COVID-19 number 3 Order 2020, travelers landing in Bermuda without a pre-arrival test will be charged $300 at the airport. There are no refunds, so you are advised to plan ahead and carefully consider if you should be traveling at all. The government's policy has not changed in this regard, and we encourage residents to be tested before returning and have your test results with you on arrival in order to avoid that $300 fee, which commenced on the 25th of January last year. If you are using the Costco Azorva health test, I ask everyone to read the company's testing procedures very carefully. The BTA has a handy outline of the process on its website at gotobermuda.com with links to the Costco site. Your options are to purchase a test kit voucher from Costco.com and have the kit shipped to your overseas accommodation, or purchase the test kit from select Costco pharmacy locations, but only after doing an online health assessment. The tests, which cost $139.99 online, are saliva tests that should deliver results within a new 5-day turnaround period. Costco membership is not a requirement. I know that the BTA is working with Costco and its partner Azova Health to address current teething issues and to provide additional information about the process, and this is a useful and welcome option for travelers to have. As people are returning to the workplace after the holidays, I want to take this opportunity to remind employers that you are responsible for providing your employees with factual information from health officials and assuring that the return to work after travel guidance is adhered to as outlined at www.gov.bm/coronavirus workplace. Over 20% of the cases that we had in the last month's outbreaks were workplace outbreaks and transmission. This reveals that workplace standards are often not rigorous enough as employees relax around coworkers. Also, some people return to work too early after travel or even when experiencing symptoms. The government's position and guidance remains that persons should work remotely when reasonably practicable. Diligence is needed as cases continue to rise overseas. Through public health officials, we can help to prepare and educate employees without causing unwarranted concern. Likewise, I would like to remind the general public that we must not become complacent or let down our guard. As I have said repeatedly, we must, as a community, follow the public health guidance and measures put in place to stop the spread of this pandemic. We cannot be irresponsible about COVID-19, a virus that is so easily transmissible. Wear your mask, wash your hands frequently and properly, use hand sanitizers, practice physical distancing, and avoid the 3 C's. Closed spaces with poor ventilation, crowded places with many people nearby, and close contact settings such as close-range conversations. 6 feet must be maintained at all times, including while greeting others. It goes without saying that the health and well-being of our community is our main priority, and we are working hard to protect you. But we need your help. Contact tracing is a fundamental part of outbreak control that's used by public health professionals around the world to prevent the spread of infections. Contact tracing is used to find people who may have been exposed to an infectious disease. If a person tests positive for coronavirus, a public health officer would speak to the patient to identify anyone who has had close contact with them during the time that they are considered to be infectious. Our contact tracers are working tirelessly to protect Bermuda from the spread of coronavirus. But some people in our community, when contacted by the contact tracer, are not cooperating. Please, and I cannot stress this enough, if you are contacted by a contact tracer, fully cooperate with them. This whole process is completely anonymous. They will protect your privacy. Your cooperation will protect the health and well-being of our community. And not cooperating could lead to further spreading of the coronavirus, which could shut down our entire economy. And if you have not already, we encourage you to download the WEHEALTH app, and it is an anonymous contact tracing tool. In closing, I would like to remind the public about the Community Mental Wellbeing Hotline availability, and the number is 543-1111, and this line is open from Monday to Saturday between the hours of 5 and 9 p.m. The Wellness Hotline is for those who may be feeling anxious, people who may be stressed while taking care of loved ones, seniors who may feel isolated, people who are having a hard time with the isolation, and those caring for their loved ones who want to chat. These are just a few examples, and if you need the support, call them, or if someone you know can benefit from this support, please encourage them to make the call at 543-1111. This support is free of charge to the public, as funding has been made available through the Bermuda Foundation with support from the Health Innovation Fund. Bermuda, stay informed on all of the latest developments about COVID-19 by regularly visiting the Government of Bermuda's website at coronavirus.gov.bm. And finally, in closing, stay safe, Bermuda, and remember, I wear a mask to protect you, and you wear a mask to protect me. Thank you.
Thank you, Minister of Health. And on behalf of the government and the people of Bermuda, I extend our condolences to the family of Bermuda's 11th COVID death that was just announced by the minister. They're reported as numbers here, but that is, without question, somebody's loved one. And we must remember that this virus can take lives. I would also like to extend my appreciation to the minister and her team at the Ministry of Health for all that they do, as well as the testing teams at the Molecular Diagnostics Laboratory and the other testing facilities. Many had to work late hours over the holiday to conduct tests and send out results so that others may be able to enjoy their Christmas with their loved ones. I also know that the work they've been doing to help us contain this outbreak has been difficult and taxing on them personally, so I thank them for their dedication. Now, the Minister of National Security will provide an update from her ministry. Minister Ming.
Good evening, Bermuda. This evening, I will provide an update on occurrences during the past weekend. Today, the Bermuda Police Service released the name of Bermuda's first road traffic accident victim. It is with heavy sadness that tonight, on behalf of the government, I am extending our condolences to the family of Aronde Wilson, Jr. Our thoughts and prayers are with his family and friends. One death on Bermuda's roads is too many. We are saddened by any serious road traffic accident and are devastated by a fatality. As a country, we need to be aware that road safety is a public safety matter. Policing Bermuda's roads is only one part of the equation. Each of us should be responsible while driving, riding, running, walking, and even crossing the road. It is imperative that all residents take seriously, act cautiously, and with concern for our own safety and the safety of others. Just as we must act responsibly on Bermuda's roads, we must also continue to do our part to adhere to the COVID-19 health guidelines and advisories. Over this past holiday weekend, I'm pleased that the majority of our residents adhered to the curfew, and we only had 7 of the persons deemed to be in breach of the curfew. These matters are being dealt with, and the persons will be before the courts in due course. Though the curfew will change to midnight, it is important as ever that everyone adheres to the revised times. The Bermuda Police Reserves will continue to support the Bermuda Police with enforcement. There have been 26 curfew breaches in total since December the 18th. It should be noted that anyone found in breach of the curfew will have a file submitted to the Department of Public Prosecutions. During the past 3 weeks, the BPS, Bermuda Police Service, COVID-19 compliance team, in partnership with the Bermuda Reserve Police, have continued with their liquor at premises across the island. As the Minister of National Security, I wish to thank all of Bermuda for making responsible decisions and taking the necessary precautions to protect themselves and their families. Generally, we've had a relatively peaceful holiday period. This is a testament to our residents who adhere to the health guidelines and advisories, which encourage people to celebrate in small bubbles in this holiday season. As you would have seen, the Bermuda Police Service issued a reminder that if you intend to be on the roads in the evening hours, please plan to ensure that you have enough time to get home before the curfew. Thank you, Bermuda. I'd also like to take this opportunity to say good evening to Zeta Beach Francis, who let me know she would be listening to the news this evening to find out what the new rules are.
Thank you very much, Minister Ming. I'd like to thank the Reserve Police for their continued support while enforcing the curfew. While I know that living with these current restrictions are easy, the government must continue, not easy, the government must continue to make the tough decisions when necessary for a safer future for the weeks and months to come. The Ministry of Health will look to increase community surveillance with increased testing for teachers, healthcare workers, and athletes in our consistent effort to keep Bermuda safe and to ensure that we keep our economy going. We want students to be able to go back to school, families to be able to visit loved ones, and for us to be able to go and enjoy some of the regular activities, such as dance on the weekends and also football matches. What we must do, what is necessary in the present, in order to ensure that we can get our lives back to normal in the near future. Looking back, we have been fortunate in being able to enjoy some forms of normality that other countries cannot. And this is due to our performance and the collective work and effort, vigilance with testing and adhering to the guidelines, wearing our masks, practicing physical distancing, and now with the support of technology, using the WEHEALTH app while shielding our vulnerable. Now, I would like to provide you with an update or changes to the public health emergency regulations following the cabinet meeting earlier today. In line with the recommendations from the Ministry of Health, the cabinet has agreed to extend most of the current restrictions in place with a few changes that I will outline. The first change is that the curfew, nightly curfew, will remain in place. However, we'll begin each night at midnight until 5 p.m., which is similar to the curfew that was in place in Phase 4 restrictions. Businesses will be required to close at 11 p.m., whereas they are currently now required to close at 10 p.m. Personal services restrictions will be relaxed to allow for the trimming of beards and other personal care services that require masks to be removed. In gyms, physical distancing requirements will be reduced from 10 feet between patrons to 6 feet. And the number of people who can attend an outdoor funeral has been increased from 10 to 20. Other restrictions remain unchanged, including gatherings remain restricted to no more than 10 people, and indoor bars and nightclubs will remain closed. While I know that this may not be welcome news for some, in the interest of public health, we have made the decision to keep bars and nightclubs closed for the time being. This, as always, will be reviewed in 2 weeks' time, and we're taking this action as we want to be absolutely sure of no spikes in or surges in cases from activity around the holidays. This is part of a targeted strategy that will allow us to open our public schools safely as it is of utmost importance that we are able to open our public schools to students next week, Wednesday, and we must be absolutely sure that the outbreak is under control before mass reopening of our bars and clubs. Persons who may work in establishments that are required to remain closed and who have been approved for assistance will receive additional payments from the Ministry of Finance. Additionally, the Bermuda Economic Development Corporation will extend and increase its support to businesses who are still under restrictions. I close today by offering a message of hope. These are, without question, the dark days of winter. It is windy, it is rainy, and in Bermuda it is cold. And this pandemic, for many, seems to be dragging on and on. However, as difficult as it may be, now is not the time to give up, and there is cause for cautious optimism. There is hope on the horizon in the form of the vaccine. And while I understand that the concern has been expressed by some locally and internationally, I think it is important to recognize we need to get back to normal. I will be getting the same vaccine, though available to you. My parents will be getting it, my wife will be getting it, and the people that I love most in my life will be getting it when it's available to them, because that is the way that we are going to beat this virus and finally rebuild our country with Bermudians at heart. Our medical professionals will speak more on the science, and I encourage you to come to them with your questions, as it is important that we are open and honest about this phase of which we're about to enter. Already around the world, millions have received the approved vaccines. There are so many stories of people who have matched the adversity of these times with a cheerful spirit or safe innovations that still brought joy. We saw recently how one family shielded 106-year-old Miss Myrtle Edness, who can remember the impact of the last pandemic, contrasted with a young couple whose journey of married life begins in the midst of a pandemic and whose love for each other could not be delayed by current circumstances. We have come so far, and I am approaching this new year with renewed optimism and promise. As a government, we have economic decisions to make, we have social issues to address, and we must continue to battle this coronavirus. It hardly seems possible that we have spent almost 10 months in this fight, but the fight must go on. As always, before I close, I must remind you, if you are feeling overwhelmed or anxious, or if you're a senior who feels isolated, or if you're caring for loved ones and need someone to talk to, the Emotional Wellbeing Hotline is there for you. The phone number is 543-1111, and the line is operated Monday to Saturday from 5 p.m. to 9 p.m. Again, that number again is 543-1111. And before I take questions from the media, I would like to apologize for what was some intemperate interactions with the valued members of our media over the last few press conferences that I attended. Like many, I was fatigued, and sometimes when you're tired, you get irritable, and I need to do a better job to not do that. So I apologize to the media, because you play a valuable role inside of our community, asking questions on behalf of persons to make sure that we can do our job to inform. So on this new year, I will say sorry, and I will do my best to be a little bit more kind. So with that, I'm happy to take questions from members of our media today.
Renee, we'll start with Bermuda broadcaster.
Good evening. And Mr. Premier, we don't take offense. We know it's been a long year.
Well, it's now a new year.
Okay. Bermuda's seniors desperately want this vaccine so they don't have to live their golden years in fear and isolation from society. How will our elderly citizens who are living at home be notified about their chances to receive the vaccine?
Don, what we're doing is we're working with the medical community in addition to a public awareness campaign that will be providing all the benefits of the vaccination and so forth, but we'll also be including in that, as we've been doing previously, working with the physician community, because many persons do have their own GP, and that there are certain doctors that will be able to administer the vaccine. It's simply because it requires a type of training to make sure that you you follow the instructions properly for administering it. So not all any doctor that wishes to do so, then they'll be able to seek approval from the Ministry of Health after they've had the requisite training. So they'll be able to, those individuals that you spoke about will be able to either access it through their own physician if the physician is providing the vaccine, or alternatively, currently at the central location, which, like I said, is the Hamilton Seventh-day Adventist Church. But what's important to note is that you must make an appointment for the vaccination. You can't just show up, because there are requirements as it relates to the registration. If anybody's taken a flu shot, and hopefully everybody has, you'll note that before you get the shot, there's questions that are asked about how are you feeling today, do you have any temperature, do you have any symptoms? And so likewise, that medical check does have to take place prior to the administration of the COVID vaccine.
So just as a follow-up, where will they be able to sign up for this?
There is a website, and we've launched the website, and I'll provide that information when we're ready to go live. So in the next couple of days, that information will be out there. But recognizing that the first tranche of the vaccine is going, I don't think you're 65 yet, so unfortunately, or you don't live in a home. So unfortunately, I'm not sure you would actually be within that first tranche of the 45, which I spoke about, namely being persons that are in our care facilities, seniors that are in our care facilities, healthcare workers, and those essential service workers.
All right, thank you. We heard just heard the sad news about the 11th COVID death. The biggest mortality risk with this virus is age. Over 80 years are being prioritized in many other countries. Is there a medical ethics group that is determining which groups get the vaccine first?
I spoke about this a couple weeks ago when I spoke about the vaccination rollout. There is a committee that's comprised of medical personnel as well as people from the Ministry of Health and other stakeholders that meet regularly, because this is not the first vaccine, obviously, that Bermuda's had. So they have regularly been meeting to discuss vaccines that come on the market and the like. So that particular group has come up with the plan for distribution, as I indicated. The first group will be those persons in rest homes and long-term care, as well as care workers and essential workers.
Okay.
At this point, we're getting enough doses for 4,500 people.
Okay, thank you. COVAX seems to be lagging far behind in the race to deliver vaccines to the world. I know we've asked this before, but it is important enough to ask again. What alternatives plans has the government made to get more vaccines here quickly, and when is the next shipment due after this initial Pfizer batch?
With respect to the COVAX facility, and you're correct, they have indicated that they are anticipating that we will be able to receive our supply by the end of Q1, beginning of Q2. So our hopes are that we will have it by April. The United Kingdom hasn't necessarily provided us with further details as to when we will be receiving further supplies of the vaccine that we're getting on Friday. But what they have assured us is that Bermuda, as well as the other OTCs, will receive the same proportion of the vaccine that the United Kingdom has secured for themselves.
Thank you. The vaccine is arriving on Friday night. Why wait until Monday to start distributing the vaccine? Why not start first thing on Saturday?
That's a very good question, and it's more about a logistical thing. Logistics. We are organizing. We've been feverishly working to organize getting ready for the vaccine and for the distribution. And though we're appreciative that persons are keen to take the vaccine, which we're encouraging everyone to do, Monday, I think, is a sufficient time for rolling out. We don't know what time the BA flight's going to come in, and I think the weekend may prove a little bit more difficult and challenging trying to operationalize things on a weekend versus having it start fresh and anew on Monday morning.
Thank you. How long until Bermuda receives enough vaccines to protect 25%, 50%, 75%, 100% of the population?
Again, regrettably, the COVAX facility has indicated that they will be supplying us our amount by the end of March, and Q1 or Q2. I'll have to look at my notes. I don't remember exactly offhand how many they're supplying us, what percentage of the population. I want to say 25%, but just stand by and I'll get that information for you. And likewise, through the United Kingdom, we will receive the same proportion that the United Kingdom receives. So if they receive 40% for their population, the expectation is us, along with the other OTs, will likewise receive 40% for our population of distribution.
Thank you.
Good evening. Premier, when would it be possible, or any consideration of having Dr. Karika Bowden on panel? Again, we have a few scientific questions for the public that would need her input.
We can have her at a future press conference if she agrees, no problem.
So you'll send out the invite?
I can have a chat with Dr. Weldon, not to worry. You don't want to ask me questions, Trevor? I can try. Huh?
About?
Whatever question you want to ask.
No, I'd rather talk to
if we can't answer it, we can defer.
I'll talk to the good doctor.
Huh?
I'll talk to the good doctor.
I can promise you I am not a doctor. I'm certainly not a accomplished biomedical scientist like Dr. Weldon.
Yes, sir.
But you can also
question.
submit written questions to the government, and we can make sure they get answered as well.
Cheers. Another question for you. What is the latest update on the Savvy Entertainment $800,000 investigation?
I have no further update than the one I gave last time.
A supplementary to the same question. Have you done any reviews to make sure that this type of action doesn't happen again?
I think, as was indicated at the time, I think there were some changes to regulations that were put in place, but I'm happy to get back to you. I don't have the information off the top of my head, to be completely honest.
Cheers. Minister of Health.
I haven't thought about Savvy in the new year yet.
Sorry?
Haven't thought about Savvy in the new year yet. Just got back to work yesterday, so just trying to prepare for the press conference, get things ready.
Okay. Minister of Health, TNN understands a top member of the surveillance unit has tested positive for the coronavirus. You spoke about earlier about taking things for granted. Are you looking at having an inquiry how this could possibly had happened?
I've never revealed particulars with respect to persons that test positive. I don't think it's an appropriate discussion to have. However, what I can say, which I think is important to reinforce, is the fact that no one is immune, quote unquote, from catching COVID. What we can do is to try our best to mitigate against it by practicing proper hand hygiene, physical distancing, and mask wearing.
Thank you. Back to the Premier. Premier, rumors continue to circulate with respect to Bill Gates and his connection to Bermuda and the government. Have you or any members of your government been in dialogue with Mr. Gates with respect to matters regarding this pandemic? And is there any truth to Mr. Gates, Bill Gates purchasing a home in Bermuda?
I have no record or knowledge of Bill Gates buying a home in Bermuda. I understand that he has visited the island. I thought it was once, but I believe it is twice. I welcome anyone to visit the country of Bermuda, especially, I would say, the second richest man in the world. I have no knowledge of any conversation, discussion between the Minister of Health, myself, or any other government official regarding anything, and I know that it makes for wonderful, fanciful conspiracy chatter and talk, but I'm certain if Bill Gates is coming to Bermuda and worried about, I guess, markets for vaccines, there will be other places than a small island of 60,000. So from that perspective, the answer to the question every single time it's asked is no. But I mean, I can't stop people from engaging in rumor, speculation, and anything else. The fact is that I think that Bermuda is a place where people like and want to visit, and I am pleased that more persons come to like and want to visit this country.
Thank you. Would you consider returning the corner to the second wave? You see the numbers are...
Sorry, you got to speak up. Sorry.
Premier or Minister of Health, do you consider that we have turned the corner to the second wave of cases that we've been experiencing?
I'm not sure we could classify this as a second wave, and the reason I say that is because, as I've spoken about previously, though we saw over 300 cases in December alone, which is higher than we've ever seen, it was as a direct result of a weekends of activities. And we weren't seeing large amounts of persons importing the disease, importing COVID. It was because of unfortunate socialization in avenues and areas where people were not practicing the proper public health guidelines. We would not have seen 300 plus cases, which affected over 500 persons being required to quarantine because of a weekends of activities. And by all reports, those weekend activities unfortunately got out of hand, and people did not exercise proper public health guidance.
And my last question, sorry. My last question? That's it.
Go on, Trevor. Have your last one.
Thank you. Thank you, Premier.
Happy New Year.
Happy New Year to you. Yes, sir. There still seems to be individuals that are having trouble calling that COVID hotline. Mm-hmm. Also with emails, trying to get emails for their results. Some are still home waiting days on days to get results, to return back to work. When can this glitch be rectified?
I'm not sure I'd agree with you as calling it a glitch. You've asked two questions, so let me address them individually. Excuse me. With respect to the COVID hotline, there is a technical issue that we're trying to resolve with respect to the phone system, because unfortunately we understand that when persons call, after a few minutes it just drops down or people are put on hold. And I'm asking everyone to please have some patience, because the reality is, particularly over the last several weeks, we have been inundated because of all the cases, because of that particular weekend of activities, where people are calling and asking questions to the COVID hotline. And I would really implore members of the public to just be patient. If you wait online, it will get answered. So my plea is to just be patient. I know for a fact that all of us, because I've done it myself, have called places like catalog stores, and you've been placed on hold because you want to change your order. We're just asking people to be patient, because the reality is the persons that work in the hotline are extremely hard and diligent working, and they field on average nowadays up to 400 or 500 calls a day. So if your call doesn't get answered and you're placed on hold, you obviously have a question and you have an inquiry, so please just be patient and wait online until such time as the question is answered. Admittingly, there is an issue that we're trying to resolve with respect to the phones sometimes disconnecting people, but the reality is just be patient. If you get disconnected, I apologize in advance, and just call back. But there are a dedicated team. We had reduced hours for Christmas Day, as well as New Year's Day. But the reality is, if you just please exercise a little bit of patience, and your questions will be answered. And the second question, I think you said with respect to results, we have provided more resources for the labs so that they're able to better address the issue concerning receiving results through the email system and so forth, and we're anticipating that those further resources that have been supplied will be able to address that issue.
Premier, I'm going to just state to you publicly, I done an extensive interview with Dr. Karika Weldon, and I apologize for the offense that I may have occurred to her. So I just want to let you know that since you've been on me about it, it's done.
Oh, thank you. I'm happy. It seems like 2021 is the year of apologies. Well done, Trevor. Thank you.
Cheers.
Take care.
Ministers, Premier, good evening. Minister Wilson, if I could just start with you first. You talked about this first batch coming in, and it's going to...
I am really, really sorry, but I'm struggling to hear you.
Talk into the mic so we can try to hear out the thing. I'm sorry.
Thank you.
Yes.
You said that this first batch that's coming in on Friday is going to provide protection for 4,500 people.
Correct.
How's that going to break down within the healthcare workers and people in education and the elderly? Because I think, according to the latest census, we have about 11,000 elderly people on the island. There's about 3,000 people working in health and education, so that's about 14,000, 15,000 people. And this is going to protect about 4,500. So who within that group is how's it going to be, who's going to make the decision as to how it's divided up?
Thank you for that. As I said previously, there's a committee that has reviewed the implementation of the vaccine plan, which also includes the distribution. And concerning the first track, for the ones that are anticipated to arrive on Friday, we would be looking at supplying it to persons that are in long-term care patients in rest homes, which is just under 500, and then healthcare workers and the essential workers would be just over 4,000. So that's where we're looking at with respect to that particular trunk. When we receive the next trunk of vaccines, then we would be looking at group 2, which would be those persons over 65, which, as you rightly said, is about 12,000 people, as well as other individuals that essential travelers or other persons that are extremely vulnerable. So we're breaking it out in phases. And just to answer Dawn's question, since it's kind of connected to yours, in addition to the 4,500 that we're receiving through the United Kingdom, OTC, are receiving that proportional amount, for the COVAX facility, we will be receiving sufficient for 25,000 people.
Okay.
Thank you.
There was a lot of talk last week about a variant.
I'm sorry, doses. Excuse me, sir.
Sure.
Doses.
Yeah.
So that's 12,500? Because it's 2 doses.
There was a lot of talk last week about this variant of the virus that was coming out of the UK. And I believe government was going to get in touch with Public Health England to see if we actually had that variant here in Bermuda. Have you got any developments on that?
What we have ascertained through the Pan American Health Organization is that the variant that we're seeing, SARS-CoV-2 variant in the United Kingdom, and now we've seen it in the United States, is that the evidence seems to suggest that that the vaccination that we are going to be acquiring in Bermuda will be able to address that particular variant. And also, Bermuda right now is not doing the sequencing like they are doing in the United Kingdom, and certainly in the United States, they've recently started doing that as well. We do have the equipment on island, and we obviously have the expertise of Dr. Karika Weldon, and we're anticipating that in this month, we will start the nanopore sequencing, which was a project that she led at Oxford University in the UK. So we're looking to do that in Bermuda as well, so that we will be able to ascertain if that variant is in fact here once we do the the sequencing.
Okay, thank you. One other question for you, Minister. I understand that there was a drop-in testing centre at Bull's Head that was operating. It's operated a few times in the last week or two. I've been down there to check it out, and there appears to be nobody using it at all. Are you concerned that people aren't aware that these testing sites are available and they're not being fully utilised?
I'm not as concerned. What we did find is that prior to probably less than a week ago, we were reserving the latter part of the day for persons that were symptomatic. As you may recall, we had a number of persons that had to be retested or were symptomatic because of the schools, because of a number of the businesses and so forth. So we had a huge amount of persons that required symptomatic testing, or which was reserved for the end of the day. And I was made to understand today that that has declined. That's simply the symptomatic part. So we're readjusting that. But the majority of the testing is already full. So we had, I think the last 2 hours of the day were reserved for symptomatic persons, but the first 8 hours of the testing were for persons that had booked online that were requiring the testing for travel or for other purposes. So there has been somewhat of a slight decrease with the symptomatic persons, but that we would anticipate that because we're now seeing a decrease in the number of active cases.
Okay, thank you. And one final question, Minister. There was also talk last week about getting more of the vaccine from the US Consul General, and there was talk about him contacting the Premier or the government, and I think the last we heard on that was that you hadn't heard from him. Have you since heard from him, or?
I have.
You want me to address?
Yes, please.
I'm happy to do so. The U.S. Consul General, I think, is off island on vacation. There was a conversation in regards to that, and the government will follow up on those particular matters. But right now, there's nothing to report on that.
Okay. Okay, and I think I've got 2 more questions.
You've asked quite a few. Okay.
Schooling. Public schools don't go back until next week. Private schools have opened as of yesterday or today. What is the reason for holding back on public schools opening? I know you mentioned it, Premier, that you want to be sure that it's safe. But if private schools can open, why can't the public schools? Do you think that it's wrong for private schools to have opened? Do you think they're opening prematurely?
No. The Minister of Health was very clear that the Ministry of Health has not closed any school on a broad level and requested schools to close. The Minister of Education had addressed the reasonings for that. They set up a committee with has educators representing the union, ministry officials to walk through the challenges. And we just wanted to make absolutely sure that we had teaching resources in place, everyone off of quarantine, making sure that we were able to open up our schools and return to remote learning. Return to in-person learning. The last thing we wanted to do is say that, school started today, and then we had an issue. And this is, rescheduling things. And sometimes some of the lessons you learn are, sometimes you have to be a little bit more proactive. But we're confident that we'll be able to return to school safely in person on the 13th. As I mentioned in my remarks, there's going to be additional screening that's going to be made available. The most important thing is that persons adhere to the guidelines which exist inside of schools, and we're going to make sure that we do the enhanced community surveillance outside of schools to make sure that we can continue. I think the most important thing is for students to be in school. Remote learning is okay. We certainly have expanded the capabilities of our remote learning environment. And credit to the IT team at the Ministry of Health, the Ministry of Education for the work of which they're doing there. But certainly, and without question, we certainly want to make sure we get our schools back in in-person learning next week, and we're certain that we'll be able to do that.
Okay. One final question, Premier. Regarding the lifting of certain restrictions, what's the rationale of reducing the curfew from 11 p.m. to midnight? Why that 1 hour? Because people might think, well, if you're allowed to stay out until midnight, why not extend it to 1 a.m. or 2 p.m. or?
Ursa, the best example I can give is that we're going in a systematic fashion as we did the last time, and as I said, that the 12 p.m. curfew matches what was in place during phase 4 when the curfew was from 12 to 5. And so this allows an additional hour of activity, places which may remain to be open. We want to support and balance, but we also are recognizing that we want to be absolutely, perfectly sure that we have control of this outbreak before we move to the next phase. We do these things, as the Minister of Health has explained. The thing is 2 incubation cycles. That would have been the ending of today. But I think when you're looking at some of the cases that are still there, the fact that we just came out of the holiday to make sure that we are not having any type of surge which may have come from the holiday. As the minister had said, I think that it's week 53, the report from the epidemiologists, which will cover the Christmas break, and we can look at next week and start to make preparations. One of the most important things is that it is not an expectation of this government that we are going to have to extend this again. And of course, if the numbers change, then we'll make different decisions. But we believe that there has been decent community response. We see that our case numbers are falling. And one of the things which came out of our cabinet meeting today is that we do not want to wait until 2 weeks from now to start making plans for bars and restaurants to be open, sporting activities to recommence, and others. So the Ministry of Youth and Culture and Sports will be reaching out to the sporting organizations to make plans, working in conjunction with the Ministry of Health in regards to testing that will be able to happen so we can get those things back up and running. There's work that's going on with the Ministry of Health in regards to bars and nightclubs, making sure that they are up to date on the regulations which are necessary in order to make sure they're safely reopening. And there's considerations, there may be some level that's able to happen before then. But the most important thing is to make sure that we are keeping ourselves safe, and the restrictions are necessary because they have been demonstrated wherever they are to work. You reduce the amount of opportunities that people have to mix, certainly in places where people are unmasked, and you have less mixing, less transmission of the virus. And I think that with the work the Ministry of Health has done over the month of December, and certainly that the community has done up to this time, I, without question, see the light at the end of the tunnel. I don't like it. Certainly the Ministry of Finance doesn't like it. I'm sure that bar owners and bar owners and others don't like it as well. But I think that it's far better for us to be completely safe while providing the financial support that we can to businesses and individuals than opening prematurely and having a wider challenge that we have.
Okay. Premier, Ministers, thank you so much.
Mm-hmm. Thank you.
Good evening, everyone.
Evening.
Happy New Year to everyone there.
To you as well, Ms. Palacio.
Thank you. My first question to the Honorable Premier Burt, this is a community question. A parent of a student at Dalwood was granted compensation for the mandatory quarantine from November 28th to the 11th this week. Their understanding was that the government would pay $500 for each week. However, this parent only received a portion amount of $214. When they inquired, the government worker explained that it was due to the fact that the unemployment benefit came into effect after the ordered quarantine time for Dalwood families. So the question is, where should families affected during that time find financial support for the loss of income?
Okay, that would be an individual case. It seems a little bit strange. My best advice would be for that individual to email Minister of Finance at gov.bm, and I'm sure the minister will look into that, and we can resolve that. That's not what we want to do, certainly, and certainly there were challenges which occurred, and the reason why we put in that assistance was for persons that were in mandatory quarantine that were unable to work so they could have some form of basic income. But yes, I'd encourage the community person to email Minister of Finance at gov.bm, and I'm sure the Ministry of Finance team will look into that and make the necessary adjustments.
Okay. They did inquire to the Ministry of Finance team. They sent me the
I've got
response.
it, but they might have been the team, but not the minister.
Oh, himself.
Minister
Okay.
if that email will go to the Minister of Finance.
Okay, thank you very much. And Minister Kim Wilson, of those who are symptomatic from being positive from COVID-19, what types of symptoms are they experiencing? Example, like respiratory symptoms, and what are the severity of it?
I don't have the information about the level of severity, but the symptoms that are generally that are generally exhibited are flu-like symptoms, loss of taste, loss of smell, diarrhea, nausea, stomach-type symptoms.
Okay, thank you very much. Another one for you, Minister Wilson. Can you please identify who gets tested for COVID-19 the most and the least on the island? For example, like what age group and what gender registers to get tested the most on the island?
We've conducted, let me tell you. Hang on a minute. I'm sorry. That might have been a question. If I can get that information for you on another occasion, because we've conducted over 147,000 tests. So I don't have the breakdown of what that represents insofar as percentages concerning race, sex, orientation, and so forth. I can seek to get that information. I'm not sure how easy quantifiable that is, but let me find out for you and I'll get back to you.
Thank you very much. And my subsequent question to that was actually if the government could possibly add those results when they have normally when you guys have the test results put out daily, like out of 1,000, 8 were positive or so on and so forth, and you usually have like some charts there explaining at the bottom if people can go into that link, if that could be placed there, just saying like, the age of people and the gender of the people who got tested on this day, the highest and lowest, if that's a possibility.
I'll look into that.
Thank you very much. My next question, actually, is for Premier David Burt. An update on the WEHEALTH app. Some persons are asking, how many codes have been used and how many persons have been alerted from the close contact, and generally, how has this app overall assisted in our community COVID defense?
I have been on vacation, so I just got back yesterday. I don't actually have that information. Just for the record, I did not leave the island. I was here. But I don't have that information. I'll ask the communications team to get that and to email it to you. Minister, I don't know if you have anything to add on how it's been helping with the contact tracing teams from your meetings that you've had.
No, I don't. No, I know it's a great resource because it's allowing our contact tracers to be able to utilize an application as opposed to human resources. So that's why we're certainly encouraging persons to download that app so that it will assist us tremendously with respect to contact tracing.
Mm-hmm. Yeah. I remember the last report, there was, I don't remember how many reported, but we'll certainly get that number to you this evening. I know that they'll ask and we'll get that number off to you.
Okay, thank you very much.
No problem.
Next question is, for persons who are visiting from the US and UK and who have already been vaccinated, what are the quarantine protocols, if there are any, that change for them?
We have a designated person within the ministry that's actually leading on that initiative so that we can ascertain what exactly will be the protocols for persons. At this point, the evidence doesn't support the fact that because you're vaccinated that you cannot still transmit the virus. So there's a number of nuances that need to be discussed and evaluated clearly based principally on the evidence and the scientific matters. So that is something that is being charged with by somebody in the ministry that's leading on that particular initiative. Because the other question is when persons arrive with a vaccination, do they need to be in quarantine? Do they, if you've got a vaccination here, what are the challenges, if any, that went for traveling? All of those are very, very important matters that we've identified, a resource that is leading on that particular initiative.
Thank you. And then my final question, which is quite long, it's a community concern, so I'll try to read it as clear as possible. A message came from a Bermuda resident who was getting their scheduled COVID test on January 1st at 10 a.m. They said a couple stood in front of them and the woman lost her yellow wristband, the wristband that is supposed to be given to people when they arrive on the island. According to the resident watching, the staff just gave her a new one without asking any questions like how long have you been without it or when did you notice it was gone, nothing. And according to the government site, it says that removal of the wristband is not permitted and can result in a $500 fine and home quarantine with an electronic monitoring bracelet. So my question is, does the Department of Health keep record of those who have lost their wristband? And how many replacement wristbands has the government given? And how many times has this happened?
I do not believe we keep a record with respect to how many people have lost the wristband. The professionals at the PROTs, which are the ones that are normally putting on a new one because that's where the travelers go to be the travelers testing clinic is at PROTs, and those would be the persons that are wearing the wristband. Given their level of professionalism, we do allow them to have a degree of discretion. So if somebody comes and it's tattered, I've seen some of them, and you probably have as well, and it's no longer yellow and it looks destroyed or so forth, or it's falling off and the person literally has it in their pocket, then the persons at the PROTs will just simply give them a new one. But every time you get the test, your day 8 and your day 14, you will receive a new band. But to my knowledge, based on the information I received, it hasn't been heavily abused where people are just destroying them and walking out. So I can't comment on this particular case that you're referring to on January 1st, but I do not believe that there's been over abuse of the process with respect to persons destroying or removing their bands.
Thank you, Minister. And what I'll say is that I thank you for raising that question. That is incredibly concerning, and I'll certainly ask the Minister of Health to look into that, because if wristbands are removed, the law must be enforced, and persons need to understand that that is something that's important. So thank you for sharing that question, because that's something that's certainly of concern.
Thank you. And I know, but there were some questions quickly from the statements that you guys said earlier. When does the curfew and all the new regulations come into place?
That's an excellent question. It's something that I was trying to correspond with the drafters. It certainly, as the cabinet met today, the regulations have to be drafted and then sent up to government house for signature. So I would not anticipate before Thursday.
Before Thursday.
Yes.
And
we'll try to get them done for tomorrow.
Thank you. And to clarify the 10 to 20 person gatherings now, can you just clarify that one more time?
It's 10 to 20 at funerals. Funerals
Outdoors.
only. Outdoor funerals only. That's just for funerals. Yes, 20 attendees, which mirrors some of the restrictions that were held when we were under the emergency, state of emergency. So we recognize that funerals are a spreading event. It is difficult for people to be at a funeral and not to hug and embrace. We know that funerals have contributed to some of the challenges of which we have had, and that is the reason why that is important. But the restriction was set at 10. That's what it was. We recognize that that has not been followed. We are making sure that the regulations are clarified. The Minister of Health is reaching out to funeral homes so they can be very clear as the regulations that exist. It is a difficult time period. Certainly, I recognize it. Certainly, I understand it. But the difficulty that people have with that. But we are trying to ensure that we can control this outbreak so we can return to a sense of normality.
Thank you. And just to clarify one more time, that means indoor gatherings are still at 10.
10 across the board. The 10 has not changed. The only adjustment has been outdoor funerals have been increased from 10 to 20. That is the only adjustment in regards to group gathering size.
Thank you very much.
No problem. Happy to
Have a good
clarify.
evening.
Okay. Well, thank you very much. for your attention this evening. The ministers and I will be back with you next week, Tuesday, with a further update. Please make sure that you continue to follow the guidance. And as I said in my closing, certainly we are seeing the end of this outbreak, but it's responsible on all of us to make sure that we continue to do our work. One of the complaints that we had before the holidays is that there was nowhere to get tested. Well, you should note that there are testing appointments that are available. So if you or anyone in your family may have been out or different things, please take advantage of the free coronavirus testing that is available. You can go on the website coronavirus.gov.pm and book a test for tomorrow if you wish. All right, so with that, I want to thank you for your attention and good night, Bermuda.